Hi, I'm Dr. Anna Baranowsky, and I'm really happy to be here today with Avi Craimer. And Avi is actually a meditation teacher, and he really has a deep knowledge of self-compassion, compassion approaches, as well as spiritual emergency, and what it means to go through a dark night of the soul. So these are topics that I see more and more in my practice, and I've noticed over time that people are talking more about their spiritual life after experiencing trauma personally. And I find that this is a question that's coming up really frequently in my practice lately, and I thought it would be just great for us to have a chance to speak about what you do and your perspective on what spiritual approaches are doing to people to help them navigate their traumas, as well as better understanding different approaches that can help too. So thank you so much, Avi, for joining us. And maybe you could just talk a little bit to start with your background and how you got to do what you do.
Okay, yeah. So, I started out being more of an academic. I was studying philosophy in grad school, and I started a meditation practice. And actually, it was through the meditation practice that I kind of came into an experience of spiritual emergency or dark night of the soul. And what I mean by that is a kind of intense, quite traumatic experience, actually, that was actually initiated or prompted through my meditation practice. It was on my first silent meditation retreat, a week-long silent meditation retreat, that I had a profound shift in my experience of my embodiment, my experience of the world, and it actually was quite traumatic. There were blissful aspects to it, there were beautiful aspects to it, but there was also profound terror and all kinds of very, very difficult and negative experiences associated with it as well.
So you mentioned a couple of things. First of all, just the term spiritual emergency, that came from Dr. Stan Grof, who really kind of came up with the term and helped people to recognize that they can actually experience something that is very profoundly distressing when they get in touch with the depth of their being, like what you just described.
Yeah.
And the other thing that you just talked about that I think people don't know about at all, another doctor, Dr. Daniel Ingram, talks about what can happen to an individual when they start to uncover their inner reality, or maybe they're bigger than inner reality, their inner and outer reality, who we are as human beings and how profound that can be. And when people get in touch with it, it can be very unsettling. And a lot of people go into these meditation programs and they think, oh, this is so wonderful, I'll try this thing out. And then they encounter this access to the inner layers and the outer layers of their being that they didn't really have a sense of before, and they can be very shattered by it, which is not what people expect going into meditation. Yeah. So can you talk a little bit about that?
Definitely, yeah. I mean, now I wanted to start by saying that, I'm currently a meditation teacher, and with most of the students I work with and teach in my classes and stuff, they don't encounter the level of intensity, that I experienced or that some other clients I've worked with have experienced. So I don't want people to think, oh, we should be afraid of meditation. It's something, it's generally with more intensive practice that these types of things can start to happen, and even then it's only for, a certain percentage of people. But yes, I think more intensive meditation practice that are oriented more towards the kind of deep transformations that in some traditions would have been called awakening, or seeking a kind of real spiritual change. Although some people get there without really particularly seeking that, just through doing the practice. Can cause this kind of, like you said, a kind of opening up to deeper layers of our consciousness, of our being, of our psyche, and often that can be profoundly terrifying. I mean,
spend a little time helping me understand your perspective of particularly terrifying. Like, why are you using terrifying? What has happened that would make you use that language?
Well, and I think, I use that word because it was a dominant aspect of my experience. For other people, it may be other things like would come into a depression or sadness. I experienced a lot of that kind of stuff too. But extremes of emotion are a common theme.
With this kind of emerging awakening?
Yes. And what can happen is, so one thing Willoughby Britton, who's done a lot of research on this, talks about is the de-repression of psychic material, right? And so if not even if you haven't had a particularly traumatic past, we all have, sort of these powerful forces from childhood, Freudian kind of id stuff, right? That's in us, and if that barrier between, that kind of normally contains that ego barrier that normally contains that is broken, right? Which a lot of these practices they purport to do is kind of break down the ego, right? And sometimes they're effective at that, and to the point that sometimes some of this stuff from this lower floor of consciousness, this kind of id consciousness, can start to come up into the conscious mind, and that can be very difficult to deal with.
Because there's a layer that protects us from all of that content.
Yes.
And particularly if it's pre-verbal content where, maybe there was a trauma at mother's birth or something like that, and now you think you might be able to get access to it. Willoughby Britton, she works as a researcher, and she looks particularly at what happens to people when they go into these contemplative practices. And it seems that she is encountering huge numbers of people, actually, who have found themselves doing, what's supposed to be a lovely practice, a yoga practice, or a meditation practice, or they went to, a mindfulness-based stress reduction program, and, sometime within that practice, they find themselves unfolding into this place of extreme fragility. Rather than feeling more composed and more at peace in their life, they actually find themselves, not being well. So how do you tell the difference between a spiritual emergency or just, panic, anxiety, depression?
Right. Well, that's a great question, because it can be very difficult. And I think one of the reasons this sort of thing is underreported is because usually if people go on a retreat and they start having what appears to be a kind of mental breakdown, right, it's attributed to a pre-existing mental illness, or maybe a sort of propensity towards mental illness. And I'm not saying, and I don't know, how often that may be true, but I don't think it's always true. I think that sometimes the difficulty, the emergency, is actually prompted as a result of the meditative process, and that's also something Daniel Ingram talks a lot about.
Yes. But Daniel does a really good job of mapping it out.
Yes,
so the reader who's experienced some phenomena like you have can look at the maps that he's drawn and see kind of very particular kinds of behaviors or typified manners that are coming to the surface.
So those maps can be very helpful, and I think a general rule, those are very specific maps that come out of the Theravada Buddhist tradition, and I think Daniel himself would acknowledge it doesn't always look exactly that way, depending on what tradition somebody's coming from. If somebody's practicing Kundalini yoga, it might not look quite the same as it does if you're doing, Vipassana Theravada type practice. So it can manifest differently, but there are common themes. And I mean, one of the common themes is that there's a kind of intertwinedness between the positive aspects of the practice, right? The sense of a movement towards greater freedom from suffering, towards greater liberation, bliss, the kinds of things we associate with the positive side of spirituality. Those are intertwined with these negative experiences in a way that they're not necessarily if you're dealing with an ordinary type of mental illness. Which isn't to say mental illness can't have a spiritual component. I think it often does. But with these spiritual emergencies, there really is a kind of, I think, a more closely knit connection between the spiritual practice and the changes that spiritual practice is bringing about in the person's system, and then these experiences of difficulty or emergency or dark night.
And so there are some famous examples like Teresa of Avalon and St. John of the Cross, in which you get these really profound insights paired with like extreme and excruciating misery. And so it's like being able to tear them apart and go like, what is this and what is that, and what's the flavor of the experience that would help the person undergoing this recognize that they are moving into a place that's actually part of their evolution as human beings. And although it may be frightening like you described, it's actually part of their growth as a human being towards a more spiritual aspect in their life.
Yes, and I mean, I think one thing I really emphasize when I'm working one-on-one with clients doing spiritual guidance work is to recognize it as a spiritual process, to recognize that the emergency, the bad stuff, the stuff that seems bad, is part and parcel of this process of transformation. That recognition is very healing in and of itself. For example, with the Teresa, just knowing about cases like you mentioned, Teresa of Avila and many other mystics in all traditions across the board who had this kind of struggle, right? And if you read their accounts, they describe it, right? They describe the terrors. Christian mystics would often talk about the kind of hellfires and attacked by demons and stuff, and that's kind of one manifestation it could take, right? And in Buddhist discourse, they describe it in terms of these dukkha jnanas, or suffering stages of the process that Daniel describes. So whatever different tradition you look at, there is this stage of purification or of challenge or difficulty that the contemplative person has to go through on the path towards liberation.
And yet in our very, rational, practical world, I think when most people encounter this type of thing, even the meditation teachers don't necessarily know what is happening with the student, and the world in which we live in lacks that holding for these kind of unfoldings, and so people could be left in this very unfortunate state, not knowing where to turn and not having any resources. And I will just mention one really good resource for people if this is registering for them. Rick Archer has a really great podcast called Buddhist at the Gas Pump, and it's really easy to subscribe for it. And he actually gives lots of current examples of spiritually awakening people, and so it starts to put things in perspective, because as you said, they're in every single tradition. These kind of phenomena come to the surface. It's just that we don't typically discuss this issue.
Yes. Absolutely, yeah. I think reading accounts of historical accounts, and also, as you say, contemporary accounts of people like in those interviews, and Vincent Horn's podcast, Buddhist Geeks, also has a lot of great interviews with people about this kind of stuff. It's so helpful, going through it, like when I was going through it, working with a teacher, I worked with Vincent for a few years, actually. He really helped me out with this stuff, and also reading about Willoughby Britton's work and Daniel's work and all that was all very normalizing, and gives you the confidence to kind of move through it. I think that's a big part of it. It's just having the confidence to know that this too shall pass, and that you can kind of actually move through it, right?
So did you have a realization early on that this was, like, this terror that you were experiencing was part of your spiritual growth, or were you just left kind of going, what is this?
Yeah, well, I mean, for me, because it happened in the context of a meditation retreat, and also because it was really intertwined with these amazing insights, like these really positive insights, right? Like I was having experiences that felt to me at the time like I was becoming enlightened, I was becoming awakened, right? I mean, it's hard to describe these types of ineffable mystical experiences, and I didn't even have the language or context to really label them at the time, but looking back on them, I can say, yeah, there was that expansiveness, that sense of freedom from suffering and liberation and bliss and connecting to a higher purpose, and all of that stuff, that we associate with spirituality was happening to me. But at the same time, I was coming in and out of these really incredibly difficult states, right? It was like, so it was that movement back and forth that meant I never really just saw it as purely a mental illness, although I did have to recognize that there was a component that I needed to address, right? I mean, I did, particularly for the panic and the terror that I was experiencing, I got psychological counseling, did CBT for panic attacks, and that was very helpful. But I had to address, but if I had only done that, I don't think it would have addressed the whole thing. It had to be together with also getting guidance around the meditation and the spiritual piece, and seeking that, I also work with a Jungian therapist who really helped me to understand a lot of that psychic material that was coming up, right? The kind of imagery and symbols and archetypes that were manifesting, right? I needed to work with those and make meaning of them.
So really use all the aspects, throw everything at it.
Yeah, that was essentially my
throw everything at it.
Throw the kitchen sink, find and when you're in that kind of a crisis, that's maybe it's not a natural response to everybody, but I do think you just kind of you take whatever works, right? Like you don't
as you should.
Yeah,
absolutely. But it seems like you had this experience, but not everybody around you was having these kinds of experiences. What do you think kind of was unique about you and your experience, or what came from the past? Because remember, I mean, my perspective is always about trauma, and I believe that the past, whether it's in your own generation, something that happened to you, or something coming through your genetic tree, that the past can pour into the present.
Mm-hmm.
So what do you think it was about you and your own history, who you are as a person on this planet, that these profound phenomena were arising?
Yeah, I think it's a really hard question to answer.
It is, sure.
There were certainly, I would certainly have things where memories, where stuff from my past would come up. But whether that's the reason, I mean, it's really hard to say. I mean, I guess I just have to say I don't know, right? I don't know the answer to that question. I might have some glimmers of clues and stuff about it, but ultimately why this happened to me in this particular way when other people experience it differently, I don't know.
Because I think it is more typical, like people will go, as we were talking before, to a mindfulness-based stress reduction program or some kind of meditation, and just find it to be, lovely and easy, or, not that easy, because you have to be quiet for a long period of time. That's not easy in itself. But just that they walk away often from these kinds of experiences feeling that it was something that lightened their burden. It didn't create a heavier burden. And
so, yes, and I think it's important to recognize there are just these different temperaments, I guess you could say. I mean, most people have what's called a dry process, which is a dry spiritual process, which is what you're describing. So that means, they go on retreat, or even if they sit with their daily practice, and they make these kind of incremental gains, right? They kind of feel a little more relaxed, a little calmer. Bit by bit, they work through some of their patterns kind of a little bit at a time, and they start getting, maybe having long-term personality change over years or decades of practice, right? Mm-hmm. And then you have what's called a wet process. I mean, these labels are kind of arbitrary.
I've never heard of it like this, but it sounds really interesting.
Then you have what's called a wet process, and this is a minority of people, but still not a tiny minority. So I think sometimes people underestimate teachers, including meditation teachers, because often meditation teachers themselves have had a dry process, and so they don't really understand the wet process. Mm-hmm. But the wet process is much more like these dramatic mystics, like people like Saint Teresa of Avila or Ramakrishna, or the Buddha probably, right? People who had a very dramatic kind of spiritual awakening, and for them it's like fireworks, right? Like it's like they sit in meditation, even sometimes just for a few minutes, and there's surges of energy, and there's visions, and there's spontaneous movements, and there's all kinds of stuff that's going on that doesn't necessarily happen for the average person who goes on retreat. And of course, in our society, we can tend to pathologize that and see it as, is this person mentally ill, or, and yet, if we look at the context of contemplative traditions in history, we see that these types of phenomena are actually quite normal in the context of spiritual practice, which isn't to say mental illness can't also be a factor, but it doesn't necessarily have to be seen in that lens.
So, just to wrap up, because we will just wrap up shortly, what would you recommend to somebody who's doing some kind of practice and finding themselves encountering phenomena or terror? Because, the dark night of the soul can feel like a profound depression, but it's actually a human evolution, as in this uncovering and unfolding of who we really are. So what would you recommend to people who are encountering something like this? First, how to tell, what is this? And two, what to do?
Yeah, that's a great question. So I think, first of all, the how to tell question, it can be helpful to reflect on sort of what was the course of the of the challenges or the crisis that you're facing, and is it kind of related to experiences that you might describe as spiritual or mystical or, that sort of thing? Was it related to a spiritual practice you did?
Mm-hmm.
Now, it's not always going to be like a formal spiritual practice. Sometimes it might be somebody who takes a psychedelic drug, or they, just are at an all-night dance party or something. Things that can produce altered states of consciousness, even if it's not intentionally trying to do it, right? Mm-hmm. But often it will be related to a formal spiritual practice. So those are some questions you can ask. And then you can also just talk to somebody, a teacher who has experience with these types of more unusual states of consciousness and stuff like that. So not all meditation teachers will have any experience, and many of them will steer you wrong because they will just...
Because they had a dry process.
Right. And so they'll just kind of be like, I don't know what's going on with you,
Mm-hmm.
Maybe they'll think you're mentally ill, or maybe they'll just kind of not have any real advice for you. They'll just tell you to kind of be mindful and ride it out, which isn't, by the way, always the best advice when you're dealing with a crisis, because,
Mm-hmm.
that crisis level intensity isn't always something you just want to try to sit with equanimously. So that can create more trauma.
So Avi, you're this type of person, this type of teacher.
So just to wrap up, so what I would say is that the biggest piece of advice I can give for working with this kind of levels of intensity in your practice is to something called self-pacing, which basically means you want to keep practicing. So you want to keep moving forward in your practice, whatever your practice is, if it's a mindfulness practice, if it's a devotional practice, if it's a yoga practice. But you also want to not just keep upping the intensity levels. So this is where people sometimes get in trouble if they're, going on long silent retreats, for example, and they're just going deeper and deeper and deeper into this process, and it's kind of adding fuel to the fire, right? They're kind of upping the intensity levels. And if you already have a wet process and you're already actively in this kind of crisis, you don't necessarily want to up those intensity levels quite so much. So doing a kind of a shorter practice, but regularly, it can be a really helpful thing. So in other words, instead of practicing 4 hours a day, as you might be inclined to do if you're in the midst of this process,
Mm-hmm.
Try to practice, an hour a day or half an hour a day, and then do other things that are kind of, nourishing and grounding, like going for walks in nature, being with close friends and family, all the ordinary things we might do to just kind of feel good and take care of ourselves, but also to establish a sense of normalcy. Right?
Mm-hmm.
Or to reinforce that sense of normalcy. Mm-hmm. And then at times you may need to also seek out therapy, and if it gets to be too, very intense,
Mm-hmm.
Just knowing that the therapy is not necessarily going to deal with every aspect of the problem, but it can help with certain particular aspects of it.
Right, and or work with a therapist who has some idea of what spiritual crisis might be, or the fact that this kind of wet process you described actually does happen, and it's part of human evolution, where we are arising to be, hopefully, more of what we're supposed to be as human beings.
Yeah, and and then there's sort of therapy in the sense of counseling and stuff, but there can also be other forms of healing that can be very helpful, like body work, craniosacral therapy, those types of things, right? That kind of rebalance the nervous system, right, in a more direct, hands-on kind of way.
Wow, that's great advice. So I also just want to mention that Avi is actually a teacher, and he is available for consultation too. I think you have a website. Do you want to just say what it is if people feel that they should get in touch with you?
Yeah, so my website is avicraimer.com. I'm sure you'll put a link in the description.
Oh, we will, yeah.
Mm-hmm. And so you can sort of see what I do there. I teach meditation and other spiritual practices, and I work with people one-on-one, either in person if you live in Toronto, or via Skype or FaceTime if you're out of town.
So great ideas and advice, and thank you also for sharing your own experience, your personal experience, and also this wet and dry, which is a very interesting way to look at what can happen in a meditation situation or when you're practicing anything on a contemplative level. This is Dr. Anna Baranowsky. Thank you so much, Avi, for joining us. Wishing you a gentle day.